So let's talk about FAI, or Femoroacetabular Impingement Syndrome. So what it is typically where the femur head comes into the acetabulum or the hip joint itself. They're just not at like the proper angle or the position where it should be, what they would consider like normal anatomical position. And what that can do is it can put extra stress on the labrum or the cartilage that's in the hip joint itself and start creating problems. So there's two different types of FAI that is possible in your condition. One type is where you would see that the femur head is just not in that perfect circular ball appearance. Where another type might be more so the pelvis or the acetabulum or the hip joint itself may not be in that perfectly smooth ball position as well. So one or the other condition types, you could potentially get that bone on bone, that awkward range of motion movements or pain when you move in certain ranges of motion because you're just not having that like perfect ball and socket feel. Now, the most common type of FAI is where you kind of have a combination of both. So you tend to have a little bit of degenerative changes into the hip as well as the femur head, and that's where you really start to see that kind of that bone on bone, that rubbing sensation, that impingement feeling that you would get because the ball and socket joint, which the hip should be, is just not able to kind of get full range of motion. So during typical flexion type of movements, or also like internal rotation, like where the hip kind of goes in and out, you'll tend to get that impingement because just the positioning or the appearance of the bones into the joint are just not moving and grooving like they should be. Okay, so before we get to the clinical aspect of FAI, I do want to throw this little tidbit in from the evidence that says that FAI is the most underdiagnosed and misdiagnosed condition related to the hip. And I thought that was a really interesting fun fact. So when we come into the office, typically patients would come in, we'll see some kind of popping or clicking maybe into the joint. Typically patients will kind of describe it as like dull and achy, especially on activities that require some kind of flexion or internal rotation. Maybe if they want to sit down and kind of cross legs, or if they want to go up and down stairs, or if they're doing a lot of sitting, we tend to get kind of that dull and achy pain because the hip itself may not be able to just get into that position without that kind of that pinching of the bone on bone sensation. So how we would treat this in the office is typically kind of our general adjustments into the hips, into the pelvis, into the low back, as well as we would love to get in some kind of myofascial release. So we like to utilize dry needling a lot for this condition because when the joint itself is not in like perfect alignment, or if you're having kind of that bone on bone sensation, typically the musculature around that area will get extremely tight. So we do like to get some needles into there, kind of the deeper muscles of the hips and into the anterior and the posterior hips. It kind of helps just release some of that tension. But we also like to incorporate strengthening exercises as well as kind of some just range of motion exercises itself. Now, some of the research out there nowadays is kind of talking about how we don't necessarily need to passively stretch this area, or we may not be able to put too much manipulation or stress into the area because that could make this a little worse. So the research is kind of pointing more towards strength training, building up the strength into the hips and the glutes and the core, and then kind of just incorporating just slow, active range of motion on your behalf. might know someone that's having kind of that nagging, dull and achy hip pain, our office would love to help. We'd love to take a look at it, kind of give you a good idea of, could it be FAI or could it not be? So give the office a call at 513-463-3011 and we would be happy to take a look. Thanks.